So checking out our schedule here, we're at the first. So we're at training instruction. We will be, that's actually 2-5. Today's 2-1. So it is 2-1, not 2-5. But we are in training instruction. We'll be talking about corrective exercises today. We're also going to look at exercise videos today. And then we may even perform some movements in the lab today. Thursday this week is going to be dedicated to physical fitness only. So there's going to be no lecture this Thursday. So, sorry. Why is this wrong here? Is that supposed to be 2-1 right here? Okay, so let's just forget about that. Okay, this Thursday we're gonna have a training session. So next Thursday is gonna be our first test. Okay, and the Tuesday before our next test next week, we'll go over your assignment, which is due on the 13th. Okay, next Sunday. So next Tuesday, we're going to go over that assignment. If you have questions on that, we'll go over all that on Tuesday. We're going to work out this Thursday, and today we're going to go over corrective exercises, and then we're going to look at some videos of the different exercises, and we're going to look at some of the muscles as well so that we know exactly what muscles do what and what exercises work our muscles. All right, so let's just first start with corrective exercises. It's just it's a 10-minute video. After this 10-minute video, we'll start going into those exercises, and we'll look at NCSF videos related to those exercises. So primarily on training instruction today. All right.
In this lesson, we will cover key concepts related to corrective exercise. Let's begin by making sure we understand the actual purpose of corrective exercise. Corrective exercise can be defined as activities which restore or enhance joint function via improvements in the neuromuscular and musculoskeletal systems. It is an important part of any program for clients who have strength imbalances, poor mobility, and/or faulty activation patterns. For those who have various musculoskeletal issues, the exercise professional should use corrective applications first to remove limitations and establish function before working on other health and performance-related goals. You need a stable baseline to support physical enhancements.
So basically, we have to train our clients to be functional before they just go into deadlifts, back squats, or overhead shoulder presses. If we don't have the ability to reach overhead without using our lumbar spine, we shouldn't have our clients do a pull down or a shoulder press. That doesn't mean that they're not going to go off and do it on their own, but we have to make sure that when we're training them, we're liable if they get injured, because if they don't have that range of motion and you're letting them do something like that and they get injured, then it's your fault. So a lot of this is just built in for liability as well, but really to create a better human.
Corrective exercise should be a priority for those with known issues for the following reasons. Biomechanical issues impact posture, promote faulty movement patterns, and create muscle activation problems. Consequent postural changes affect both form and force closure. Biomechanical dysfunction inhibits health and fitness-related goals. And distortions can cause chronic pain and increase the risk for injury. Let's progress by making sure we can properly quantify levels of dysfunction, so we know what to work on first with clients who have many issues. Quantifying issues plays a major part in the development of a useful needs analysis. A needs analysis can be defined as an inventory of adaptation requirements for an individual as determined by screening and evaluation protocols.
Okay, NCSF, their terminology for, I guess, creating a plan for someone is called a needs analysis. So basically is they go over your range of motion. Can you do the overhead mobility? Can you do the shoulder test? Can you do the hip drop down test? That type of stuff. Once they figure out where you're at, they create a needs analysis based on maybe your blood pressure, previous injuries, that type of thing.
It is essential a program to do this. Within this list, primary and secondary limitations should be categorized for prioritization in the program. Primary limitations are those which cause significant training restrictions and pain, as well as impede function and performance. These issues require immediate corrective exercise and emphasis in the program. An example would be the presence of upper or lower cross syndrome. Secondary limitations are those that tend to reduce one's ability to perform certain tasks, but they usually do not cause chronic pain. These issues warrant adjunct corrective work and extra attention. An example would be slight hamstring tightness.
So we don't want to be overcritical either. If someone's got slight hamstring tightness, we don't want to spend 10, 15 minutes rolling and trying to stretch that hamstring. It's probably not going to do that much. We want to, if you've ever heard of raise your hand if you've heard of the FMS, functional movement screen. So basically, if you're going to be a trainer, you'll probably be trained to understand what that is. We may go over that. NCSF doesn't have it in their protocols, but the functional movement screen is used in the combine to assess the athlete's range of motion, and they've shown that if they have more range of motion, they're going to perform better. And so they can look at, can they get into a split stance inline lunge without any balance issues going straight up and straight down, or are they wobbling the whole time? Can they reach their hands behind their shoulders? Can they do that overhead mobility shoulder squat? Can they bring their foot up and over and around something and then come back without losing their balance? And they want to know, are you at a 1, 2, or 3? So that's another way you can assess clients is using the FMS, but NCSF uses just like your typical typical research protocols, which often have like names like Apley shoulder test, stuff like that.
Let's now review applications of corrective strategies by
Wow, that's different.
use of motor reversal, chain and circuit manipulation within a program, and the use of varying loading patterns. We will begin by taking a look at the usefulness of motor rehearsal, which should be applied in the early phases of a corrective exercise program. Motor rehearsal can be defined as the repeated exposure to a movement pattern, which enhances neuromuscular efficiency over time. Essentially, practice makes perfect. With limited exposure to corrective movements, premature neural pathways will be developed that can be easily disrupted, and the client may digress back to improper form or compensatory actions. Adequate motor rehearsal is needed early on to re-educate the neuromuscular system of the client. The hardest clients to fix are those that performed exercises incorrectly for many years, because they will take a longer time to relearn proper form. Let's progress by looking at the use of varying chains and circuits within an exercise program. Fitness professionals should understand and recognize the specific uses for open and closed kinetic chain, as well as open and closed kinetic circuit exercises. They should also know how to mix and match chains and circuits for program design strategies that best match a client's needs.
And they do like to ask these questions on the CPT.
Forces applied to a distally fixed position, requiring the body to stabilize segments across the kinetic chain. Essentially, the body moves around the object. The object, in many cases, is the ground. Examples include the military press, pull-ups, push-ups, deadlifts, squats, and lunges. Open kinetic chain exercises are those where the force is applied to a movable object around a distally fixed position, reducing stability requirements, but allowing for more isolated loading. Now the object moves around the body. Examples include cable lat pull-downs, bench press, leg curl, and seated bicep curls. Closed circuit exercises are those where both working limbs are connected to the same load, which minimizes the stability demands while also increasing the potential for loading. Examples include barbell bench press, barbell bent over row, and leg press. Open circuit exercises are those where each limb must manage a separate load on its own, which enhances localized stability demands while also increasing the potential for range of motion. Examples include the dumbbell chest press, dumbbell overhead press, and dumbbell lunges. As mentioned, chains and circuits should be manipulated to meet a client's specific needs. Consider the following practical applications. When the primary needs are range of motion and stability, closed chain open circuit exercises are the best choice. Here being the standing dumbbell press. When the primary need is strength, closed chain closed circuit exercises are the best choice. Here being the military press. And when the primary need is hypertrophy, open chain with both open and closed circuit exercises can be useful. Here being the seated dumbbell and barbell overhead presses. Let's finish our examination of corrective applications by looking at loading modifications. Common modifications include unilateral, overhead, ipsilateral, or asymmetrical, and unfamiliar loading. Exercise professionals should recognize that bilateral exercises are most commonly compromised by clients who have strength imbalances or mobility issues. Nonetheless, bilateral loading is useful for employing heavier strength-based lifts, but only if proper form can be maintained. For many clients, unilateral loading can be used to fix faulty movement patterns seen during bilateral lifts, and it is also useful to improve muscle activation, range of motion, and stability. Overhead loading can be employed to elongate the kinetic chain, which allows for increased central stabilization demands to work on core function improvements. Asymmetrical loading is not symmetrical in the sagittal or frontal plane, while ipsilateral loading requires all weight to be managed on only one side of the body. Both loading patterns can be used to increase central and peripheral stability, prime mover activation across a broader relative range, and often lateral muscle activity. And finally, unfamiliar loading can be used to enhance adaptations for experienced clients by placing the resistance in a manner the body is not accustomed to, such as sandbag, bear hug, lateral squats. Let's finish this lesson by taking a look at a few corrective exercise examples to see if we can connect the dots. For this first exercise, dumbbell Bulgarian swings, try to identify a few issues we could fix with the movement. You will now be given a short period to consider potential answers. Okay, for this exercise, the following could be addressed. Tightness in the latissimus dorsi and hip flexors, poor core activation and stability, poor gluteal activation, and shoulder immobility. These are just a few examples. Let's take a look at one more, the step back with T-pole. You will now be given a short period to consider potential answers.
Okay, what do you think would be dysfunctions here? What are we trying to correct? Okay, we're looking at areas in the shoulder. Anything else?
Okay, for this exercise, the following could be addressed. Tightness in the rotator cuff, specifically the internal rotators, as well as the shoulder flexors. Poor mid-lower trapezius, posterior deltoid, and rhomboid activation, as seen with the upper cross syndrome, and psoas group tightness, even though only minimal attention is given to this issue with the small step back. Again, these are just a few prime examples. This concludes.
So basically just trying to counteract that kyphotic posture and trying to bring us back to neutral. And then psoas group, just taking a tiny step back is going to stretch that psoas. So just putting yourself into positions that kind of, are on one leg. So you're focusing on one leg or the other as opposed to just two legs. So just different ways to perform corrective exercises. We're going to go over some more. And just a little review for the module learning, I have recorded all of our lectures from class, and then I have recorded videos of each PowerPoint. The videos that I show you in class are from the internet site. Now, if you don't have access to the book, or if you didn't purchase the online materials, then we only get to watch that in class, okay? There's no way I could go over every single PowerPoint, every single video in class, so I don't. So that's why it's really important for you to make sure that you are going over the PowerPoints, or if you like just listening to the PowerPoints, you can just listen to the video. So either or, whether you're looking at these PowerPoints or listening to the lectures, and then also coming to lecture, or if you're not coming to lecture, watching the videos from lecture. And if you don't come to lecture and you don't watch the videos, you know, you're not going to get everything from Canvas, is what I'm saying. And then also, if you didn't purchase the book, there may be some questions on some of the quizzes that you might not get right because you might not have all that information, okay? So I would say about 85–90% of the questions are going to be pretty familiar, and then there might be about 10% that we didn't cover in class. So just keep that, just be aware that there's no way I can possibly go over every single thing in this class in 2 hours, basically, a week. So I try to do the best I can. I probably do more in this class than most of my other classes.
So is the test on the first 2 modules?
Yes.
Okay. And then how do you set up your test? Is it on campus?
It'll be in class. I'll probably separate you so that you're not sitting next to each other. And I'm not sure if I do 20. I think I might do about 20 questions for the quizzes, and then the final is 50. I think that's how I set it up usually. And I think they're worth like 10% each. I can look at that real quick. See what the percentages. I'm pretty sure it's 10%, and I do 20 questions, so each point is worth 0.2. Yep. Each test is worth 10%. Your final is 20%, and there's 50 total questions. All right. So we'll go over the functional anatomy assignment Tuesday next week. I do want to go over some of the movement, some of the muscles, and then also the movements, and then also some example exercises, and look at some video. So obviously we have the rectus abdominis, which is responsible for trunk flexion, and there's exercises like the ab curl up you can perform. So we'll just kind of go over some of those videos that they offer on the site in case you don't have the website and you want to, look at some of the actual workouts. So we're going to go over some of those right now. So we have the ab curl up, obviously rectus abdominis. Now, if somebody has lower back pain, I probably wouldn't recommend the curl up. I might go for more of a front plank, side plank, more anti-core rotational stuff than sit-ups if they have back pain. Obviously, if a woman is pregnant, you don't want to do anything on your back or stomach. You want to do things seated or standing, actually, because you can actually limit blood flow to the baby if you're on your back, and obviously you don't want to be on your stomach. Okay, we have the external oblique. Remember, the external oblique turns into the what? So external oblique has an angle downward, and it turns into the what? Internal oblique. Okay, external turns into internal oblique. Example exercise, the diagonal chop. They don't have a video, so the diagonal chop basically is taking a rope and reaching across and high. Usually your front leg is forward. You can go kneeling, pull, chop. You can do it static, so pull, chop, but you want to make sure that you're watching it. So pull, chop. You can do that half kneeling, pull, chop. You can do standing, pull, chop, and then you can do dynamic. Okay, so that would be more external oblique. Internal oblique, you have the flexes and rotates vertebral column. Let's see if they have the cable torso. Cable torso. So they don't have that. It's like, why would you tell us that you have the cable torso? Then I'll make a video. So cable torso. So that's going like this across the body. So that would be more internal oblique. Noticing that this is, my arms are a little bit lower, so maybe that's probably why. So if I go up higher, maybe I'm getting more external oblique here, and then internal oblique a little bit lower. Transverse abdominis, so compression of the abdomen. Things like the draw-in. Let's see if they have the draw-in. Nope, draw-in is not here. So the draw-in is when you're on your hands and knees. You take an inhale through your nose, you brace the core. You're not extended or flexed. You're in this neutral spine position. And then you take an inhale, fill up 360, and then huge exhale. And that's going to light up your transverse abdominis. Okay? Let's see what else we got here. We have the erector spinae group. Okay, so that goes up from the base of the skull all the way to the bottom of the pelvis. Okay, that is your strongest muscles of the back, the erector spinae group. Let's see if they have a good morning example. I assume they would. Okay, working the erector spinae. What sling system is this? Guess. There's 4. Just guess. Just it's all right to guess. Just lateral, longitudinal, posterior, or anterior. Longitudinal. Yeah, longitudinal is that straight line up the back. Okay. All right, so let's check out some more. Deltoid, side raise. The deltoids horizontally abduct, flex, extend, and rotate the humerus. Side raise, for my deltoids, I can take weights and go up like that. Side raise is definitely not something in my program. It's more of a, I guess, if you're limited in what you can do, that might help a client feel like they're, working their arms or shoulders. So let's see if they have an example of a side raise. No examples for us. It's all right. Latissimus dorsi, so the adducts medially rotates and extends the humerus. Okay, that's your lats. All right, pull up. Let's see if they have a good example for us here. Hopefully they do. Really? No pull up either? Oh, I'll have to. I'll show you a pull up over there in a little bit. How about that? Pectoris major. Okay, your biggest muscle on your chest. You have your pectoris major. And what's the other muscle that's in your chest? If you have major, you're going to have what? Minor. Yeah, if you hear something like superior, or something that's superior, or maybe like medius, you're going to have maximus. If you're going to have brevis, you're going to have max. You're going to have so you got your adductor longus, adductor max, and then you have your adductor brevis. Bench press, let's see if they have a good example for us. They should. Bench press, where are we? All right. Teres major. Let's look at where the teres major is. The teres major is not part of your rotator cuff. So your teres minor is part of your rotator cuff. Your teres major is a little bit lower. It adducts, extends, and immediately rotates your humerus, something like a single arm row. See if they have an example of that. Single arm row. I don't see any single arm row. They got a lot of other exercises. Single arm row. I'm not sure how they instruct this one. I could look at the their actual thing. I like to have my hand on a box or a bench and row like this. I know some people will put one knee on the bench, and I'll show you what I mean. But what that does is it makes them rotate and actually move a little bit more. So single arm row. would get the teres major, the coccybrachialis. Okay, coccybrachialis is located in the by the humeral head, and I don't think they have a picture here for us, but it also helps extends and externally rotates the humerus. Okay, the humerus is what bone? Point to your humerus. Yep, your upper arm. Okay, so something like the front raise, which adducts and flexes the humerus. Let's see if they have a front raise example for us. Front raise. They have a front raise. Here we go. Oh, okay, not an upright row. Front raise, straight arm. Okay. Infraspinatus. Infra meaning below. Okay, below. And you have supra meaning above. Okay. Infraspinatus is part of the rotator cuff group. Extends and externally rotates the humerus, something like an external band rotation, something like that. Let's see if they have an example of external band rotation for us. I don't see any. Okay, so anything that looks like this. Subscapularis, so it's below the scapula, below scapula. Extends and internally rotates the humerus, so internal band rotation, so something like this. So that would be more infraspinatus, or sorry, subscapularis. Supraspinatus, which is above, abducts the humerus, and something like the empty can raise. See if they have an example of that. I don't think they do. Okay, so basically just empty can, like you're turning a can and you're emptying it. That would be an empty can raise. Teres minor, external band rotations. We just went over that one. That also works your teres minor, which is right above your teres major and inserts into your glenoid fossa. Looking at some other muscles, your trapezius, which is a triangle-shaped muscle here, something like a shoulder shrug. So it elevates, it depresses the scapula, it rotates, it fixes the scapula, extends cervical spine. Okay, that also takes place in the trap. Something like the shoulder shrug. Let's see if they have shoulder shrug. Don't have a shoulder shrug, but holding on to two dumbbells and elevating your traps would be working them, and you can use dumbbells or barbells. Rhomboid major. So we have a rhomboid major, which is in between the scapula. When you pinch your shoulder blades together, or like you're trying to crack a nut between your shoulder blades, that's your rhomboids working. Something like a seated row. Should have an example here of a seated row, right? Seated row. Seated trunk. No, they don't. They don't, I'm sorry. But I think you've all seen a seated row. Pectoris minor, something like chest fly. That's going to engage the pec minors a little bit more. Let's see if we have an example of a chest fly. No, I don't see one. Could be under dumbbell chest fly, maybe? Dumbbell chest fly, there we go. You don't want your arms too straight if you're doing these. This, I think, is more for hypertrophy than it is for strength, more for a bodybuilder type of individual that's looking to work different areas of their chest if that's their goal, right? I might not necessarily add the dumbbell chest fly if I have the bench or dumbbell press available or incline press available. But if it is someone like a bodybuilder, I may recommend that. So your levator scapulae, right along your neck, right beside your sternocleidomastoid, something like a high row. I believe that's going to be the high row. See if they have an example for us. No, no high row. But I believe that would be your upright row if you've heard of the upright row before. You have your different grips, pronated, palms down, supinated, palms up, so like you're holding on to soup, neutral grip, or I've heard that is also called hammer grip, like you're holding onto a hammer, and then alternating is supinated and pronated. Biceps brachii, we've all heard or seen the biceps, flexes and supinates the forearm, flexes and abducts the arm, something like a bicep curl. Triceps brachii, extends the forearm, extends and abducts the arm, something like a tricep pushdown. We've probably seen those before. Has anyone not seen a tricep pushdown before, or doesn't know what a tricep pushdown is? Okay, so basically just taking the weight and just pushing it down, right? Simple single joint movement. Brachioradialis flexes the forearm, something like a hammer curl is going to get that. The brachioradialis is right here. You can kind of see it right in there. It's your kind of hammer muscle, hammer curl. Brachialis flexes the forearm, so something like reverse grip curl. So going like this, it's going to get more of the brachialis. So flexes the forearm. The flexor carpioradialis flexes and abducts the wrist, so something like a wrist curl. Let's see if they have any wrist curls. It doesn't look like it. So wrist curls, you can put your hand on a bench and kind of curl it like this. You can put your hands like this while you're holding onto a barbell for wrist curls. You can do it standing. You can do it behind. Again, that's probably something more for strongman, someone that's trying to build grip strength, or a bodybuilder. That's not something I might. Maybe an older individual who lacks grip strength could use something like that. So. Flexor carpi ulnaris, so it's closer to the ulna on the ulnar side, so it should be on the medial side. Something like wrist curls, extensor carpioradialis, those are going to be on top, the extensors. Okay, and then carpi ulnaris. So obviously one is going to be closer to the radius, and one's going to be closer or attached to the ulna. That's why they're called those names. Okay. You have your psoas major, something like a knee raise. Okay, flexes the hip. That's your psoas major. Your iliacus, diagonal knee raise, so going across. Let's see if they have a diagonal knee raise example. I doubt it. They don't. Gluteus max extends the hip, adducts the hip, and laterally rotates the thigh, or externally rotates the thigh. Something like a squat, right? Medius, abducts and medially rotates the thigh, so a lateral squat is going to target more of that medius. We talked about the medius is also a stabilizer on unilateral. You have your gluteus minimus, which is inside deep in the hip bone, and that helps abduct and medially rotates the thigh. So that's similar to the medius. So the medius and minimus kind of work together. You have the tensor fasciae lata. That's that pocket muscle right here. So right where your pocket is your TFL, your tensor fasciae lata. Abducts and medially rotates the thigh, just like the minimus and medius. So they kind of work together. So something like a supine leg abduction. Piriformis laterally rotates and abducts thigh. So abduct and externally rotate. So this would be a piriformis stretch here. Rotational step out. So using rotation while you're stepping out. So that might be something like step back like that, and then coming back. Okay. Let's see if they have a rotational step out. They got everything else but what they talk about on the thing. Quadratus femoris. Okay, laterally rotates and abducts thigh. That is another rotational step out. Quadratus femoris. Let's see if we have it. Okay. Rectus femoris, that is your long rectus, meaning straight down. Femoris, right on the femur. that extends the leg, flexes the thigh and hip, extends the leg, and also something like a front squat is going to get your rectus femoris. And see if we can see a front squat. You got a front squat for us? You got a front squat. Okay, there we go. Getting the rec fem. The rec fem is part of your quad group. 4 muscles in your quad. Rec fem. You have your vastus medius, vastus lateralis, and then what's the 4th one? It's another vastus. Vastus medius, vastus lateralis, vastus intermedius, and rectus femoris. Those are the 4 muscles that make up your quads. Okay, so vastus lateralis extends the leg, something like a lunge. That's going to get your vastus lateralis. On the outside lateral aspect, then you have your vastus medius, which is on the inside. Okay, something like a leg extension. Sartorius, that's that kind of the S shape that kind of goes from the outside of the hip to the inside of the knee. See if they have a good, yep. Sartorius goes from the outside of the hip to the inside of the knee. That's going to be something like a lateral step up. So working the lateral plane. Where it is, the adductor shows what it does. It's another stabilizer. Biceps femoris, that's your biceps of your thigh. So it does the same thing as your biceps up here. It will flex and laterally rotate the leg, and it also extends the thigh. Okay, something like a Romanian deadlift is going to get your biceps femoris, which is part of your hamstring groups, the best. Let's see here if we can find a Romanian deadlift. Okay, feet are a little wider than hip. Neutral spine. Notice that the back is parallel with the floor. Working what sling system there? Longitudinal, good. We have the semitendinosus, semimembranosus. They do basically the same thing. Those are part of your hamstring groups. Your semimembranosus, let's see if they have a good picture of it. Semimembranosus is more muscle, and the semitendinosus is more tendon. Okay, the membranosus is a little bigger and wider. They both extend the thigh and flex, immediately rotate the leg, something like a supine leg curl. So basically, laying on your stomach and flexing your knee is going to hit both the tendinosus and membranosus. Also the standing leg curl, so what I'm doing now. Now, what does your hamstring do? I mean, in dead person anatomy, yes, it does flex the knee. That's what the hamstrings do. But when we walk, we don't go like this, right? So what it does when we walk during gait is it eccentrically decelerates and isometrically contracts, more so than it does this. We have to eccentrically accelerate and take that pressure in the hamstring, and we're trying to prevent knee flexion. So we're just stabilizing on one leg. That's why something like the straight leg deadlift is so important. We're eccentrically contracting and concentrically contracting. Adductor brevis, longus, and magnus. So those, remember that brevis, when we're doing this stretch here with our knees wide and sitting back, our brevis, we're going to feel it mainly, and then when we abduct one leg and get long, we're going to get more of the longus and magnus, because you can see that they attach distally to that femur. Okay. Pectinus adducts and flexes thigh, something like a cable adduction, so going across like this. Like a side plank. Remember we were doing the side plank, and we have our top leg pushing into the ground. That would get the pectinus there. That is the third inner thigh muscle there inside the adductor group. Does anybody remember the innermost muscle here that isn't labeled? Starts with a G. Groin, gracilis, close, good. So groin, gracilis. The gastroc soleus, okay, those are your posterior calf muscles. We call it the calf group or whatever you want to call it. Standing leg press and seated calf raise. Your soleus turns on when your knees are bent and you're pushing, and then your gastroc is more when your knees are straight. Okay, so that's how you would differentiate how you want, if you wanted to focus on one more than the other. If you're working the soleus in the bent knee position and gastroc, straight leg. So if I was stretching the gastroc, I probably have a straight leg. For the soleus, I would start to bend that knee. Okay, the fibularis, the tibialis anterior, along the anterior side of the tibia. It's that when you flex your toes up in dorsiflexion, you feel that muscle. That's your tibialis anterior. Your peroneus tortuous and peroneus brevis and peroneus longus. Those are on the sides of your lower limbs here. Okay, you'll feel those when you foam roll a little bit. Mine are pretty thick on my right side because I broke my fibula, which is the outer bone, and the muscles on that bone, which are the peroneals, grew back a little bit thicker in that area. So I can always feel my peroneals when I foam roll. All right, so that was all the functional anatomy. Now we're going to have a little bit of now we're going to move into I think I have some corrective slides too I want to show you. So there's things in the PowerPoint that aren't in those videos we watch, such as some of these here. All right, so if we're looking at someone with a forward chin posture, what are some corrective exercises we may be able to perform? Something like a single arm row, good morning, Y and T reaches. See, let's see if they have T and Y reaches. So something like a T, or you can just go like that and then Y. So that's all they mean by that. In using bands to correct that. Something kyphotic exaggeration, U bar high row, suspension T pulls. See if they have the suspension T pull. That would be nice. Suspension T pull. So has anyone ever used TRX before? That's what they mean by suspension. So if the client is got their arms extended, make sure you get this on too. Their arms are extended. They're going to pull like this, and that's going to be what that means. Okay, suspension T pull. So you're pulling yourself into that T position. So we're trying to work those posterior upper back muscles to improve our kyphotic exaggeration. We have a kyphotic curve. Okay, so kyphotic exaggeration is when it comes over a little bit more. Kyphosis, tight joint capsule, that's when it's going to be probably a little bit tighter. So you have the joints that are tight. You have IYT reaches, something like 2 bench push-ups, upper cross syndrome. You have some overactive internal rotators, overactive pectoris and lats, band T pulls, reverse lunge with contra reach. You have reverse back flies, suspension wide row. See if we can see that reverse lunge, if they have that one available for us. What do y'all think? Reverse lunge. Well, here's some of those reaches. So these would be all corrective exercises here. You can use a bench here on an incline. You can also use an exercise ball. Okay, here's that reverse lunge with contralateral reach. Whoa. So if I'm So that would be a corrective exercise. All right. For upper cross syndrome. Lordosis or lower cross syndrome, or you have in lordosis overactive hip flexors, so that's when the pelvis shifts into anterior pelvic tilt. Overactive low back, okay? Reverse lunge, wide leg back reach, knee rolls on back, and medicine ball pull over to stand. Let's see if they have that medicine ball. We got some medicine ball diagonal chops. Let's check out their diagonal chops. Okay, is that external or internal oblique? Remember we talked about diagonal chop. It would be external obliques. Good. Lower cross syndrome, overactive hip flexors and low back, and underactive abdominals and glutes. So field lunges with contra cross reach. Let's see if they have a field lunge for us. Okay. Ipsilateral reverse lunge. So ipsilateral means what? If I'm holding the weight, it's on what side? It's on one side, ipsilateral, same side. So if I'm putting all the pressure on my right leg, I have the weight in my right hand. So that would be the ipsilateral reverse lunge. Inward knees, okay, underactive glutes, overactive quads, something like a floor bridge with a ceiling reach. I believe they have that. Okay, so that would be if somebody shows the knee valgus when they're squatting, their knees cave in. Ipsilateral step up, so that same sided arm stepping up onto a box. Outward knees, okay, that's when the knees go out, so overactive calves or overactive glute medius. Something like a single floor reach. Let's see if they have that. Single floor reach. I can't even guess some of their exercises. I thought that was something else. That's one of my favorite go-to exercises. I call it single leg reach. They call it a single leg floor reach. So they have a dorsiflex bridge. What does that mean? Dorsiflex bridge. What do you think that means? Anybody know what a bridge is? Yep. And then just with your ankles in dorsiflexion. Okay. It might have a version of that for us. No. So basically doing a bridge on your back or a hip lift with your toes up in the air. And then something like a single leg pistol squat. Okay, that's what they're telling you you might be able to do for outward knees, single floor reach, split stance, toe reach. See if they have any of those. Split stance, toe reach. See if they have the pistol on here, single leg pistol. Probably one of the best exercises there is this single leg squat, single leg pistol. This isn't the pistol squat you see most people do where they go all the way down and all the way up, which is like probably the hardest, worst thing you can possibly do for your knees, unless you're a CrossFit competitor. I would never tell someone to do it. I mean, I could do it right now, but is it worth it without warming up to show off? Probably not. It's something that is like more of a party trick.
What are your thoughts on CrossFit? Do you think it's like too hard on your body, or what do you think?
Well, science would say it's too hard on your body because you're working into exhaustion and you're not worried about form, you're worried about reps. So as soon as you play into that game is like, hey, how many reps can you get even though you're exhausted? Then you're going to lose form, which means you're going to compensate, and then you're going to lose range of motion or get injured or both. So is it great for community and building camaraderie with people? Yes, if that's your sort of community. And if you're in CrossFit here, it's nothing I have against anybody in CrossFit. I did CrossFit for a full year. I enjoyed it. But then I realized I probably hurt my joints more than I needed to. And then I also realized I wasn't going to be a CrossFit competitor. So it wasn't something I was interested in like doing long term, especially in my 30s and 40s when I had to think consciously about I want to be able to play with my kid. I want to get on my hands and knees without my knees hurting. I want to be able to squat down without my knees hurting. I don't want to be sore after my workouts because that's my goal isn't to get sore because sometimes that actually negatively impacts my performance or my later workouts. Good question. Yeah, I mean, a while ago I would have said it's the best exercise workout you can possibly have, and then I've kind of reevaluated my stance on that. So types of muscle contractions, isotonic basically means you're going through concentric and eccentric with load, where concentric and eccentric are what they are without load. So it's concentric, eccentric. So there's concentric contraction, eccentric. When you add load, it's called isotonic. When you hold the load, or just if you push into a wall, immovable object, that's isometric. Isokinetic is when you're continuous. Okay. All right. We have some stuff on this whiteboard I want to go through. And then we will go perform some movements. If you didn't know, we are going to be working out this Thursday. If you came in late. So make sure that you come prepared. All right, go ahead and put your notes away, computers away. Let's go over some questions with you. See if anyone's been looking at your notes. All right. So when we're looking at the barbell bench press, and this is what NCSF guides, so don't ever think I'm taking sides, unless it's with CrossFit. No, I'm just kidding. I have a lot of friends that do CrossFit, and a lot of my friends will say, well, I don't cheat or I don't sacrifice form for effort or for my reps, and some of them don't get injured, but it's just sometimes you have to kind of be careful. So for your barbell bench press, where do you want your feet? Flat on the ground, good. Sometimes you see people with just their toes on the ground. Some people can't reach the ground, so they bring their knees in the air. That's another party trick. Putting some yoga blocks on the ground, so if the feet can't touch the ground, or something that's stable, probably not yoga blocks, it's going to be unstable, but some type of platform would help somebody who can't reach the ground. What about the hands on the bar? Where do we want them? Shoulder or just outside shoulder? Just outside. Okay, where do we want our shoulders when we're taking off our lift? Where should our shoulder, when we're on our bench, should the shoulders be off the bench or on the bench? Flat on the bench. Or just remain in contact. What about the glutes? Do we want them off or do we want them to remain in contact? Okay, same thing, remain in contact. Glutes and shoulders we want on the bench. What about the spine? Do we want anterior pelvic tilt? Do we want a posterior pelvic tilt, or do we want neutral? Yep, neutral. Unless unless this course was, called Powerlifting 101, we might have to talk about how to get up off the bench and do all this other stuff because we're trying to bench as much as possible. And so there's better ways and there's easier ways to bench, obviously. But this is a little bit more functional for our clients, for just the general population, okay? Now, do we want to bounce the bar off the chest? Okay, that's not something we want to do. I know some football coaches would be like, that's how we toughen up our athletes. Well, it's like saying, well, let's toughen up people by getting them in a purposeful car wrecks. Let's practice car wrecks, right? So when people are like, oh, we need to practice and get ready for the real thing, well, how come you don't practice blindside hits on quarterbacks, right? You got to get ready for it, right? You're going to get blindsided. Well, how come you don't practice? There's a reason why you don't do certain exercises or do certain things. Okay, the grip for the spot for bench press. Overhand, underhand, or alternate? Alternate. Okay. They want alternate grip while you're going up and if it stops. As soon as it stops, you rack it for them. Okay. If never allow it to stop and then let them just start, it's done. Okay. If they can't get it on their own, then they didn't get it. Helping them slowly. If you're into progressive overload and bodybuilding and building hypertrophy and getting sore, then yes, then that person's probably gonna go, throw it down, pull it up, throw it down, pull it up. Let's do an eccentric. Here we go. There's things you can do, but we want an alternate grip. Get it off them. Spotting dumbbell chest press. Where do we want our spot to be? Okay. For the dumbbell chest press, it's actually at the wrist. Okay. What's that? The incline dumbbell. I didn't look at the incline dumbbell. Let's see if they have it on here. And I'm just going by NCSF because I don't want to get things mixed up either. And let's see if they have an incline dumbbell. They don't have an incline dumbbell. They do have an incline barbell, which we'll go over. But for the spotting, a wrist assist may be needed. If necessary, lightly grasp the lifter's wrist to help stabilize. It's all at the wrist, okay? That's what they have, just in case you get asked that question. For the spotting dumbbell chest press, we have wrists. What about spotting for incline barbell press? You think it's wrist or elbow? So Eugene, even though it's the distal end of the humerus. So that's something that they talk about. It's the distal end of humerus. Okay, so here it would be more along right here than your actual elbow. So yeah, just short of the elbow. But generally you had the right idea on the incline. And for a dumbbell incline press, or for the barbell incline press, it's going to be at the distal end of the humerus. Now, what about a spotting for the dumbbell chest fly? Wrist or distal end? What do you think? Okay, it's going to be at the wrist. Okay. So the dumbbell chest press, we want to kind of make like a C shape with our hands. Okay, same thing for spotting incline, or for the dumbbell chest fly. Same thing, we're making like a C. Okay. What about modifications for the push-up? What's one, if they can't perform a push-up, what would be the first thing? It's not a knee push-up, but what's that? An incline. What's that? Wall push-up. So wall would be second, but modified, they want you to know that it's just call it a bench push-up. Okay, so yes, incline, just getting up. Maybe it's using the rack and setting that bar up or down, and then making it harder, bringing it down, making it easier, bringing that bar up. So a Smith machine is a good way to practice that.
Would that be the same with pull-ups, like
Yeah, more incline with the ring, or the more vertical your body is, the easier, and then the more horizontal it gets till it's perfectly horizontal, the harder it is. And with ring rows, when you're horizontal, this is probably the best system for ring rows because you can get right underneath it and pull. Whereas, and maybe we'll do some of those on Thursday, but you can get right underneath it and pull, put your foot up on like a box so that you're totally even and pull, and that's one of the best shoulder-friendly pulling exercises, especially if a client can't pull down overhead because they don't have the range of motion here. So we don't want to be working this range of motion. We'd actually rather go to a horizontal row. Plus, we know that looking at horizontal row, that is a corrective exercise in itself. Okay?
So with TRX, it's the same thing. It's like a modification for a push-up.
Yeah, TRX, you could do suspended push-up. You could do, well, when we're looking at the push-up specifically, yeah, you could definitely use that. It would be definitely harder, though. It would definitely be harder than a bench push-up because of the stability factor. Anytime you're using TRX, you're using a lot more muscles than you normally would. Okay, spotting for the military press. Okay, where do you think we should be? Distal end of humerus or wrist? Military press, so barbell military press. So distal end of humerus. All right. What about dumbbell shoulder press? Okay, it's wrist, and then it's the distal end of the. So you want to start at the wrist with getting them situated, and then we go to the distal end of the humerus. So it goes wrist to distal end. Okay, back squat. Where do we want to be for our spot? Where do we want our hands? Okay, about the armpits. So upper trunk. So hands, upper trunk. Okay. We also want hands outside or outside ribs. Okay. The spotter, how wide should their feet be when you're spotting someone? Should they be as wide as the lifter, narrower than the lifter, or wider? So you want wide feet. Okay. And you want to mirror client speed. Okay? So you want to go with them and mirror their movement while you're with them. And then you want to push up on those ribs and trunk if they need you to. Woo! Okay. Traditional deadlift. What type of spot? Y'all are confused. That's good. Because there is no typical spot for someone for deadlift. Okay? So that is just going to be cued physically and verbally. Okay, we really can't get in there and spot them. Romanian deadlift as well, and most other exercises. So I went through the book, and I went through all the spots, and I looked at what spotting exercises you need to know, right? So usually when I go through NCSF protocols or their book, I try to make sure that I'm not giving you spot techniques that you don't need. So when I looked through the book, it only showed me the spot techniques for these exercises. So these are probably the ones you need to know. And for most other exercises, they're saying that you need verbal or physical, like demonstrate physically, show them how it's done, and then verbally also show them how it's done. Okay, so that's a little. That's most in the book. If you're looking at, well, what do I need to know about, coaching cues or how to spot somebody. Okay, so that's a little bit different. Notice that it's an alternate. Let's see. It's an alternate grip for, I think we had a supinated one too. Let's see. So spotting for barbell chest press. I don't think I have it on here. So for barbell chest press, you want, let's see if I can add this in here real quick. Sorry. So for barbell chest press, it goes supinated and then alternate. Okay. Let's see. I'm just making sure I'm getting this right. So spotting for barbell chest press. It might be dumbbell because wasn't this barbell? Let me look at that real quick. I guess I got that wrong. Don't worry about that one. All right. So what sling system are we talking about here? What sling system are we talking about when we do the ballistic side step over? The lateral sling. Good. All right, you're not allowed to answer anymore. All right. Ballistic extension. So that's going from here to here. What sling system am I using? Longitudinal. What about my reverse lunge with a row? Posterior oblique. What about forward lunge with contrapress? Anterior oblique. Okay. What are varus knees? Are those do those knees go in or out? So we have varus and valgus. Varus knees go in or out, you think? So varus goes out and valgus goes in. So knee valgus is when we're squatting and those knees cave in. So what's a corrective exercise to help that VMO? Okay. Yep. The band that now for NCSF they would say like a one leg step up. Okay, would be a corrective exercise. Valgus knees they go in, varus knees go out. Okay, now let's look at the muscles in the inner unit. What is this top muscle here in our inner unit? So our inner unit is this 360-degree core. We have a muscle on the top. It flattens as it contracts when it goes down. That's helps you breathe. That's your diaphragm. Okay, the muscle tissue that stabilizes the inner core is it's the first muscle that activates when we move and when we perform the draw in. We exhale really hard. What muscle is that firing up? The draw in. I did it over there. Starts with a T. Yep, transverse what? Yep, because it's... Okay, what about this back muscle? What's this back muscle here? Supporting the inner unit. Starts with an M. Think math. There's traction, there's multifidus. Good. What's the bottom tissue here at the bottom of the inner unit? Starts with a P. Ends with it. And there's a F, P, and an F. So women have to work this muscle. Women have to work this muscle out before and after childbirth. Pelvic floor muscle. Okay. These are these local, global, or global, are these local stabilizers, global stabilizers, or global mobilizers? What would you say the inner unit would be? Local stabilizers, correct. Okay, so local stabilizers. What is the role of a local stabilizer? Does anybody know? Okay, so our local stabilizers, they control stiffness to control our system. Okay, so our multifidus is in there. Our BMO is another local stabilizer. Our soleus is a local stabilizer. Our lumbar muscle is a local stabilizer. And all four of these muscles are local stabilizers. Okay, what about global stabilizer? What would be an example of what would be the role of a global stabilizer? Anybody know what global stabilizers do? So they generate force. They generate force. Okay. We have increased stiffness. What muscles might be in the global stabilizer? What might be a global stabilizer? What do you think generates force? What muscles do you think would be in this category? Now remember, we have global mobilizers, things that move us. We have global stabilizers and local stabilizers. What would be a global stabilizer? What muscle do you think? Any guesses?
The glute actually.
So the glute med will be in here. All right. Oops. Okay. Any other guesses? Okay. Internal oblique. Okay. Rhomboids and adductors will be in there. Adductors are also mobilizers, so there are some mobilizers that are also stabilizers. Okay. Global mobilizers, they create that torque to produce movement. So they create that torque to create movement. So your glute max, adductors, hamstrings, okay, your lats, okay, those bigger muscles will be your global mobilizers, your stabilizers. They help to generate force and control the inner unit, and the inner unit just creates inner stiffness so that you can move your body, okay? So that's just a little overview of some of the stuff that we learned to see if you remembered any of it. You can take a picture of that before we leave today if you want. All right, so we are going to wrap it up. So 10:30, 10:45, we're going to wrap it up now. We're going to do a full workout Thursday. We're going to foam roll. We're going to stretch. We're going to motor control or activate. We're going to do dynamic warm-up. And then we're going to set up probably 3 or 4 stations, probably a power station, and then 3 strength stations with lower, upper, and core movements. And then we probably won't be able to do any conditioning because we don't have enough bikes for everybody. So we'll probably just close after strength. So we'll see you all on Thursday for our workout. So make sure that you come prepared to work out. Tuesday, 386, yes.
So it's not Thursday.
It's only Tuesdays.